in many, many different studies have been shown that changes in the gut are directly impacting what happens on the skin microbiome or skin disease.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff. Welcome everyone to the Learn Skin podcast. I was going to say, hey Hadar, but Hadar's not with me today, so it's just me. Nevertheless, he would normally ask me what I'm thinking. What I'm thinking is how we're going to translate all the stuff we're learning about the gut microbiome over to the skin. And boy, is that an area that's been really growing. And we are trying to understand that more and more. But we're not going to do it by ourselves. We never do here. And we've got an expert. We've got Dr. Sonal Choudhary, and she's an assistant professor of dermatology and dermatopathology. And she's also a board-certified dermatologist and dermatopathologist. And she's going to talk to us a little bit about the gut. And welcome to the podcast, Sonal.
Thank you so much, Raja. Very happy to be here.
And I know we're going to be talking about the gut-skin axis. Gosh, a lot of people talk about this right now. But before we get into that, I wanted to just get a little bit of a background on you. Can you tell us a little bit about what got you interested in dermatology in general? And now you're in a faculty position, right? So if you can tell us a little bit about that and how you've been doing your work as a member in the academic community.
It's quite an interesting story, actually. I went to medical school in India, and that makes me what they call the foreign medical graduate. And it was quite an interesting challenge that I took upon myself because I wanted to do nothing but dermatology. It was hard convincing some people that I needed to do a lot of research before I could get in. And honestly, that's what shaped me as the dermatologist I am today. Interestingly, again, my research years were all in Mohs and lasers, and as fascinating as those things still are, I think I took a special attraction towards dermatopathology. And when I finally got into residency, which I did from University of Miami, loved every bit of it. I actually got into dermatopathology fellowship, which is what brought me to Pittsburgh. And so I have been at University of Pittsburgh, done my dermatopathology fellowship in, I want to say 2016, after which I stayed on faculty here as a derm path. And for a while, I sort of organically let ideas come to me, and I was not chasing another, set of research or idea of research. And then, as always happens, something personal always takes you to the purpose in your life. I feel like that's what happened to me. And some health issues that were not getting resolved based on our current, medical support that I was approaching. While there was an interest to look into it, I feel like there was sort of a end road. And I kept on investigating that end road and met some really interesting, cool people. Same way I got into dermatology, meeting some interesting dermatologists. Here I, met people who were interested in, who were actually functional medicine doctors. And that really changed the path of how my healing took place, or still is. It's an ongoing thing. But also, in that sort of timeline, I was introduced to Learn Skin by one of my colleagues. And they were like, this is right up your alley. Like, this is something you would be so interested in. And surely and truly, they were correct. So I joined in, and I did my sort of the fellowship program with IDCP and in 2023, 2024. And after finishing that, there was no stopping. I was like, this is how academics can really integrate integrative dermatology in it. So most recently, I have had research fellows working with me. A huge team of medical students have joined in, and we have a very big team. And actually, last year we started this integrative dermatology clinic within UPMC, which has been an interesting feat because we went in with like almost no expectations with an experimental business model, and we have already seen, I want to say, about 40 patients by now. So it has been very interesting. We're trying to implement things from integrative dermatology in every shape or form, and people are extremely accepting and welcoming of this idea as patients.
You know, what's really interesting about what you're doing is this is not in the private setting where maybe there's a bit more flexibility. You're doing it in an academic setting where I'm very excited because, firstly, you're showing that you can get this done even in an environment where they can be a little bit more red tape, so to speak. But secondly, you're exposing a lot of residents and medical students and, maybe even other staff to this way of approaching medicine, which I think is obviously the right way, in my opinion. The right and wrong way kind of a thing, but just it gives your patients more options. How did you manage to work through any of the bureaucracy that's there, or what do you think was the key, person that was helping you that really helped you get it off the ground?
I think one thing that I've realized after doing absolutely brand new things that I've never done before is by asking questions. I just ask questions, and people that work closely with me will tell you the same thing, that they have started asking questions with me. So when we somebody says, "Oh yeah, you can't do that," I'll say, "Why? What stops us? What is it that I can do to get there?" And of course, if you give me a locked door, I'm going to go find an open door, right? So there's always this like, you're telling me I cannot do this. Give me all the reasons why. And then when they give me the reasons, and I'm like, okay, well, you're saying because, we cannot accomplish this in 10 minutes. I agree with you. This takes longer time. So in such appointments, I said, well, can we have long appointments? They're like, well, insurance won't cover long appointments. Okay, can we allow for self-pay? Well, we don't really do that for patients. I'm like, well, you do that in our cosmetic clinic. And so basically showing parallels or like asking questions and just rolling with it got us to a point where, without really irritating people a lot, being extra pushy, not that.
But a little bit, right, Sonal? A
Little
little.
bit, yeah. You have to be a little bit behind your purpose, otherwise you will never get anywhere. It's just like anything in life. So I think I have been very, very fortunate because, like, our department chair, he's an innovator. He loves the idea of being the first on anything, and he loves the idea of catering to the patients with a lot of alternatives and options. And when I bring a sort of business model that approaches all of those things. And I'm not going to sell short your ideas and support in this as well, because even every time in Learn Skin these type of questions have arose, we have got to see different people doing it in different ways. So I have taken away a lot from there, and kind of incorporated all of that in this. And this is still evolving. Like, this is not where it needs to be. It's a very early stage. People don't even know that this exists. We don't have much advertising on this end, but when people do show up, every single person says how amazing this was. The money doesn't matter, and it's a pretty small amount of money anyway. They're very, very happy with it. So I think asking questions, pushing the envelope a little bit at a time, and just working with cool people who want to do new things.
Well, and this is very cool just to listen to you, and maybe it's part of the ethos, right, for you being a foreign, quote, foreign medical trainee, and then coming here and then figuring out your path for dermatology. But maybe that's a conversation for a different day. But that for sure took a lot of perseverance and not taking just any sort of no for an answer. Wouldn't
Agreed.
you agree? Yeah. Well, let's talk about the gut because I think that's what we wanted to focus on. And so there's a lot of discussion about how does the gut connect to the skin. So can you give us a bit of background on this and then also this notion of quote dysbiosis. So yeah, get us introduced. How does the gut skin axis work?
Yeah, well, gut, skin, and then there's brain, and then there will be other organ axis as well. But we're focusing on the gut skin axis right now. And I think it is not foreign to say at this point, a lot of people are already talking about this, whether in science and social media, it's all translating that, human gut microbiome is a very complicated, very diverse, environment, and it has bacteria, and it also has viruses and fungi. So all these things are coexisting together. When we say there's good bacteria or virus or fungi and there's bad, we're basically talking about there's some commensals which normally live there, and there can be a change in that environment for n number of reasons that can lead to disease state. So going from biosis or homeostasis, like normal environment there, where the gut is functioning at its optimal capacity, everything is balanced, and nothing is overabundant or over deficient. That's sort of that balanced state. And in that balanced state, gut does a lot of things. It has actions from like immune modulation to how hormone bioavailability is going to be, or complement activation, antimicrobial peptide enhancement, like name it. Like it has so many things. And it also translates into what happens on the skin, because the changes in the gut now mechanistically in many, many different studies have been shown that changes in the gut are directly impacting what happens on the skin microbiome or skin disease. So when dysbiosis occurs, now we're looking at a healthy gut. If you're looking at a healthy gut, you're seeing a good microbial diversity, or you're looking at low levels of pathogenic organisms. There's a good mucosal barrier. Tight junctions between the enterocytes, between the intestinal cells, are solid. There's not much inflammation in the mucosa. Now, all of these turn into the opposite in leaky gut. So you will have lower microbial diversity usually. You might see a sort of a depleted mucosal layer, overabundance of what we call bad bacteria, and lots of inflammation. So from biosis to dysbiosis, that's sort of the translation. And that's how that change in the gut has been shown to lead to systemic inflammation and also skin disease.
Well, now when you're looking at how the gut is made up and what kind of stimulates the gut to either be in a quote healthy state or not, of course, food and nutrition come up as a big thing. But help us build this bridge between the gut and say, different skin disorders. Is there one dysbiotic signature that's always going to cause psoriasis or always going to cause acne? How do you think through this? Because, a lot of my patients will say, well, if I have, especially if they have acne and they come in, they'll say, well, there must be something that's like, the thing that's the root cause of my gut. And so what would be your take to that, or what's your approach on that?
So, in general, in different skin disease states, this is still a big area of research. And there is not one signature that I would say is something we should bring up. I do tell my patients what we do know from research. The firmicutes and bacteroides ratio does seem to stand out in most disease states to have an abnormality. If you speak to, which I do quite often nowadays, as part of the GI map testing, if I'm doing on my patients, I usually like to talk with the clinical scientist on the end with, say, diagnostic solutions, and I try to get their take on what they're seeing as the report on a patient. I approach it from my own sort of knowledge base of like firmicutes and bacteroides ratio, and they will often say, well, sure, that's a thing, but like in your patient, you're seeing a specific profile or signature. And then we talk about that individual's personalized report, which leads to their own targeted protocols and treatments. So I, at this point, would hate to generalize it among disease states and say, you know, you have a skin problem, whether it's atopic derm, acne, psoriasis, HS, or rosacea, and this is probably what's going on in your gut. What I can maybe say is there is something dysbiotic. Now, in atopic derm, one can maybe think of like Th2 inflammation, as we know, is one of the important things that gets highlighted. Staph aureus is an important one to talk about. So just like on the skin, when Staph aureus is causing dysbiosis or is elevated, abundant, similarly in the gut of atopic derm patients, they have found that Staph aureus is more enhanced than it should be. Or in psoriasis, we are speaking about Th17 pathway. They have found some correlations there with the levels of like firmicutes, and bacteroides. So we're still in that sort of evolving baby stage of learning about what these signatures are, will be. But we know that every disease even has its separate phenotypes. Like they present differently. An AD person can have a Th2, maybe Th1, maybe Th17, Th22 pathway. So it's hard to be like, okay, well, there's going to be one thing. I think this all leads into the personalized medicine side where you test the person's gut which is impacted by so many outside factors, genetics, environmental factors, etc. And then you look at that person, what do they need? Whether it is one thing from the toolbox of medications, or they need other things to, improve this situation with their gut. But yes, there definitely is a correlation, and like I said, mechanistically, it has been shown from psoriasis or in atopic dermatitis, in lupus, autoimmune conditions like lupus, that the gut, there's a big connection between the gut and the skin.
Now, Sonal, you mentioned a couple things in there that I just wanted to make sure you can, shed some light on. When you say firmicutes, bacteroides, can you explain what that's referring to? And then you also mentioned GI Map, Diagnostic Solutions as a company. Can you just take us through those those things that you mentioned so everybody knows what you're referring to?
Right. So we have, there's all these bacteria we talked about in the gut, and they're divided into, you can actually talk about the one species, or there's, phyla, genera. So the Firmicutes group and the Bacteroides group, these are often looked as we always often calculate a ratio on them, because that allows us to see. Now the ratios are interesting, right? Because if F is to B, Firmicutes is to Bacteroides, if both of them are low, that is a problem. That's not normal to have, but then that could potentially make a ratio to look normal. So that's why the FB ratio, I'm not going to put too much emphasis on that, but basically they are two important bacterial groups that we often look at when we're looking at a lot of different disease states. They have been studied quite a bit. Also, from the term of probiotics, the impact on these two groups is more significant. Now, in GI map is not the only test out there, by the way. There are many gut microbiome testings. Some of them are more 16S RNA based, some are more whole genome sequencing based. I have often gone after GI map with zonulin, by the way. The test that I like to do is GI map with zonulin, just because I got into it based on some of the input that I was getting as I was learning about it, that it gives a pretty comprehensive information on the species that are present in the gut. While it's bacterial, it could be H. pylori that we're looking at. We're looking at some fungal species, parasitic species, and then some also other things like steatocrit, elastase. Zonulin is an added thing. You have to pay a little extra for zonulin, but zonulin can easily be an indicator of leaky gut. So and there's a lot of other things too. This really pans out the person's like microbiome on a paper for us, at least as a snapshot of time. Of course, there could have been differences before, and there will be differences after, but that's where this type of testing can be very useful. Now, F is to B is not, like I said, I have not paid too much value on it, because as I am learning and listening from the professionals who are guiding me sometimes during these interviews and meetings, is that, it is one thing that has been found a lot in research, that, these two groups seem to show a ratio that goes up or down. It does not necessarily always guide treatment plans.
Absolutely, but thanks for taking us through that. Now, you mentioned probiotics, and I want to turn our attention there because, boy, if there are people talking about the gut microbiome, there's probably double that or triple that, and that are looking at probiotics. So, can you talk us through probiotics and what's the evidence for use in skin?
Great. I love that question because everybody asks me that question. So, probiotics are live microorganisms, such as lactobacillus, bifidobacterium. Again, these two are quite well studied, which are supposed to improve gut health. And they're supposed to enhance the intestinal barrier, regulate immune responses. So, they do a lot of good things. That's probiotics. We cannot talk about probiotics without talking about prebiotics. Prebiotics are what probiotics will eat to survive and grow and thrive. So the prebiotics become these non-digestible fibers. These can be inulin, galactoligosaccharides, and these are good for the good beneficial gut bacteria. So we want to feed good things to have good things. Then there are synbiotics, which are a combination of pro and prebiotics. There are several of those products in the market now. And then there's postbiotics, which are not the organism itself, but these are the like bioactive compounds. Like we often refer to them, one of them as short chain fatty acids, very important things. They're like fuel for the gut. And when probiotics interact with the gut bacteria, often they produce these SCFAs. SCFAs are produced naturally too from food and anything that we're consuming. So that's kind of the lineup. Now, what is important is that probiotics and prebiotics, they are strain specific. So it is a very complex thing to say, hey, take a probiotic and everything will be okay, or take a probiotics and you will have XYZ things that you will notice in today's world, and it will get probably, hopefully, only better from here, that the probiotics should be considered from their strain, what is in them, how much of that is present in there, what has it been studied for in its own research, has that product that was studied in that research exactly is what is present in the bottle that is being given to the consumer slash patient, and is it validated enough that the same outcome that was found in research is what is going to translate in this person's usage. So for example, I'm going to go into atopic dermatitis. There's already this recommendation that exists for especially high risk pregnant women, breastfeeding women, and even infants to take probiotics, and they have found that supplementation with like lactobacillus salivarius, bifidobacterium breve, like these things reduce AD severity and also improve quality of life. Interestingly, they've also seen that when these are given to the mother instead of directly to the infant, and then it goes through the mother's gut, because she's taking it by mouth, right? So it's going through her gut into getting absorbed into her blood, and then getting transferred into that infant. That has even more improved protection to the infant than giving it directly to the infant. So there's a pathway thing to it too. There's a nuance of how it is getting to who it needs to get to. So atopic derm, we have seen these names come forward, like I just mentioned. Then psoriasis, they have studied same lactobacillus bifidobacterium in so many RCTs. They found that it improves PASI scores. It has shown to reduce inflammatory markers. Acne is like my favorite one, and they've seen that we as dermatologists give so much antibiotics to our patients with acne. I have tried to make it almost a mission at this point to use it minimally. So when I give antibiotics, I often talk about how to also add a probiotic, and I try to find a probiotic that would be the right mix, which will support taking this antibiotic, but also maybe has some research to acne itself. And this might be pushing it, but there's an idea right in here, something that I personally want to study, is that, well, if there is an antibiotic that you're taking, can the probiotic maybe help to push the use of that antibiotic, like kind of take it from the antibiotic, but take the effect longer, sustain the results a little longer. And anecdotally speaking, my patients always find that when they take some of these probiotics, they find less GI upset. Their treatment effect lasts longer, even though they're only doing 7 or 14 days of acne treatment with antibiotics sometimes, which I would use as a reset at best. They've also found in the studies that they've studied just probiotic mixtures by themselves and found that IL-10, which is a marker of inflammation, well, actually, it's anti-inflammatory marker, and the markers of inflammation go down while IL-10 often would go up. They have combined it with botanical extracts, certain probiotic mixtures, and found similar results with acne. So, I mean, I can keep going, but basically, probiotics are being studied, and they have been studied based on their strains so they can be usable in a consumer when a patient asks, what can I take? I have acne and I would like to also add a probiotic or whatever, their question is. I can offer them one that has been studied for that disease state.
Well, you're very innovative. I have to say, they did some of these original studies back in, can you believe this? This was in 2013. Like, why aren't all of us
Mm,
doing this now? Where they compared minocycline against, one formulated probiotic that, that is available on the market right now.
mhm,
And they showed that taking them together actually reduced the amount of times the women got, vulvar candidiasis
right.
and seem to have a synergistic effect on bringing down the actual acne itself. So look at this. This is amazing. You're really blazing the path as we continue to move forward. Sonal, what would you say is the role of, kind of ancillary to probiotics, because we're talking about its anti-inflammatory effect. I also want to be sure we touch on another area that's, got a lot of conversation. But first of all, thanks for this overview on probiotics. But what about omega-3s? I mean, there's an area, do omega-3s have any role in this gut-skin axis as well? And how do you approach that?
Yeah, omega 3s are phenomenal. I love omega 3s. I'll start with the caution side of things. Couple of things that we should know about omega 3s that sometimes does not get talked about enough. And I think when I was like, in the program with IDCP, that's when I started to learn so much about omega 3s. So one thing is you have to always make sure that your patient is not taking a lot of blood thinners, because when you're about to give them omega 3s or about to go into a procedure, that's not a good time to start omega 3s because they will have to stop it. They should also know about what kind of omega 3s are good out there, what different types exist. If a patient is, say, vegan, for example, and you're offering them omega 3s, fish oil, they might not like that. And again, at IDCP, I learned that that actually omega 3s in the fish come from the algae that they eat. Correct me if I'm wrong, Raja, but that is right, Rhea? That the fish are the ones, I mean, the algae is the one that gives the omega 3s to the fish.
Right, right. And I think they ended up bioaccumulating it over time, but
Right.
exactly. But there are multiple sources for
There are
omega.
multiple sources, yeah. So there's an algae-derived one available. Now, going into sort of the pathomechanism of what omega-3s, like how to think about them in our own body, in our own consumption. So there are omega-3s, and then there are omega-6 fatty acids. And omega-3s are, basically they have a double bond at the third carbon atom at the end of the carbon chain. Omega-6s have it on that same double bond is present at the sixth carbon atom. That's like the molecular difference. But when omega 3 fatty acids are metabolized, or omega 6s are metabolized, they use the same enzyme. They use this enzyme called delta 6 desaturase and elongase, and they both use the same enzyme. So there's a competition to use the enzyme. Now, if you're supplementing omega 3s, but you're not looking at the omega 6 consumption intake by that person, you might completely fail with this omega 3, which is not cheap, by the way, good one. So you want to always want to talk about what has a lot of omega 6s, how to reduce the intake of that if you're trying to boost somebody's omega 3s with supplementation. So that's one piece there.
Right.
Now, omega 3s, when they get metabolized by this enzyme, they make anti inflammatory things, icosanoids, okay, like resolvins, protectants. Omega 6s, when they get metabolized, they make more pro inflammatory, meaning inflammation causing things like prostaglandins, leukotrienes. So there is sort of an ideal ratio in which omega 6 to omega 3 fatty acids are considered healthful, which is 4 is to 1. So 6 is to 3 should be about 4 is to 1. So that's kind of how I approach omega-6 in its like knowledge and information. Now, has it been studied in skin? Absolutely. Acne, omega-3s, whether you're talking ALA, which is alpha linoleic acid, or EPA, which is, and these are tongue twisters, eicosanoic pentanoic acid, or DHA,
Right.
docosahexaenoic acid, whichever piece of omega-3s we're talking about, they have been shown to improve skin barrier function, reduction in C. acnes, antioxidant effect, name it. So they have studied it in acne as a supplementation in patients, and it actually showed, and I'm not going to go into details of the study right now, but they did it with like an algae-derived omega-3 and showed reduction in acne comedonicus, both papulopustular acne, non-inflammatory, inflammatory acne from visit 1 to visit 4. They have studied it in AD, seen that higher omega-3 and omega-6 and DHA levels, they reduce allergic disease risk, and not just AD. I'm talking allergic conjunctivitis, allergic urticaria, etc. So that was a goal there. And psoriasis, of course, omega-3s have a huge role because it reduces gut inflammation, it modulates gut bacteria. So it impacts, taking omega-3s impacts gut bacteria, especially like bifidobacteria. It can inhibit what we call like harmful bacteria like E. coli, and so on and so forth.
Yeah, this is such an area that requires so much kind of evolving research. But Sonal, this is amazing. You kind of have given us, not kind of, you've given us a really good overview on the gut microbiome, given us an overview on the probiotics and omega-3s. And, we know that this is going to shift and change as we go along. But, hopefully it's just getting more and more research studies and really honing in on which one can be used in which kind of a space. Now, Sonal, you do not only do you work in the academic setting, you're really pushing boundaries there, but you're also speaking at the IDS, the Integrative Dermatology Symposium.
Mhm.
And Sonal keeps referring to IDCP. That's the Integrative Dermatology Certificate Program that LearnSkin puts on. So please, for those that are really interested in taking a deeper dive, check that out online at LearnSkin. But Sonal, tell us about what you're going to be speaking on at the upcoming IDS. By the way, for everybody listening, the Integrative Dermatology Symposium, it's going to be in Arizona this year in Tucson in August. But Sonal, tell us, what are you talking about?
So I will see you all at IDS, and that's where we'll be talking more about the gut microbiome and its impact on inflammatory skin diseases. Some of the things we just chatted about, we're going to go into more details on that. But we can also, I will be definitely touching upon more diet, on how to utilize that for skin disease management, how that impacts the gut-skin axis that we know of. Some of the newer and older actually drugs and innovative therapies that are around that are impacting the gut microbiome and either swaying it, improving, or not making it worse, some of the skin diseases. And some of the difficult to treat inflammatory skin diseases, we can find more tools by learning about this aspect of our body. Most importantly, I will also talk about GLP-1s and gut microbiome.
Love it.
So stay tuned.
No, love it. And Sonal, thank you again for joining us for this podcast. And then we hope to do more with you.
Thank you. It was my pleasure. So fun.
And that's a wrap for today's episode. But Raja, every time we dive into these conversations, it feels like there's still so much more to uncover.
Exactly, Hadar. That's why I look forward to IDS every year. It's the perfect place to continue exploring the latest in research, sharing ideas, and learning how to apply integrative strategies in real-world dermatology practice.
And this year's theme couldn't be more relevant. Guide your patients towards a healthy biome and optimal skin health. We know that skin health isn't just about treating the surface. It's about understanding the biome and how it connects to the overall health of our patients.
And that's exactly what we'll be tackling at the 8th Integrative Dermatology Symposium happening August 21st through the 24th in Tucson, Arizona.
Now, we've got an amazing lineup of expert-led sessions covering key dermatology conditions like eczema, psoriasis, vitiligo, alopecia areata, and melasma, plus insights into how movement, weight loss, and even coca polyphenols can impact your skin health.
Now, who doesn't want some good cocoa polyphenols? I know you do, Hadar, and you and your food addictions. And what really makes IDS special is the interactive format. It's not just about sitting through lectures, and we really make that a point. We'll have real-world case discussions, hands-on workshops, and plenty of opportunities to connect with colleagues who are just as passionate about integrative dermatology as we are.
And folks, let's not forget about the location. That's the perfect place to learn and recharge. And you can relax by the waterfalls, stargaze under the Arizona sky, play around a golf or tennis, or unwind at the spa. And of course, we'll have evening receptions where you can catch up with your colleagues and make new connections.
Now, who doesn't want to go stargazing and whisper sweet integrative everythings, not nothings, Hadar, to each other? Now, that sounds like the ideal way to learn, recharge, and connect all in one weekend. And if you haven't already, head over to integrativedermatologysymposium.com to check out all the details and save your spot now.
That's integrativedermatologysymposium.com. And as a special thank you to our podcast listeners, we're excited to offer 15% off your IDS registration. Just use the code podcast15 when you sign up. Simply head over to integrativedermatologysymposium.com to register. We can't wait to see you at IDS 2025 in Tucson, Arizona. Let's take integrative dermatology to the next level together.